Hello everyone, and welcome to today's class. In this video, we are going to talk about one of the most important phases of a woman's life, early pregnancy care, and the risks involved during the first trimester. This period, especially the first 12 weeks, is the most delicate and critical stage of pregnancy. Proper care during this time not only protects the mother, but also plays a crucial role in the healthy development of the baby. This video is for educational purposes and awareness only. Always consult your doctor for medical advice. What happens in early pregnancy? Let's first understand what happens in early pregnancy. Pregnancy is usually counted from the first day of the last menstrual period. In the first few weeks, the fertilized egg implants inside the uterus and the placenta starts forming. By the 5th to 8th week, most major organs of the baby, such as the brain, heart, spinal cord, and other important structures, begin to develop. Because these organs are forming, this is considered the most sensitive phase. Any harmful exposure, like certain medicines, alcohol, or infections, can affect the developing baby. The mother may experience hormonal changes that cause tiredness, mood swings, nausea, breast tenderness, and frequent urination. Common early pregnancy symptoms. Now let's talk about common symptoms of early pregnancy. The first and most important sign is a missed period. A pregnancy test usually becomes positive after a missed period. Other symptoms include nausea and vomiting, often called morning sickness, breast tenderness, increased urination, mild abdominal cramps, and sometimes slight spotting. These symptoms vary from woman to woman. If pregnancy is suspected, it is always better to do a urine pregnancy test after a missed period for accurate results. First doctor visit. Once pregnancy is confirmed, the first step should be visiting a doctor or an antenatal clinic as early as possible. During the first visit, the doctor will ask about your medical history, previous pregnancies, miscarriages, if any, and any existing conditions like diabetes or thyroid disorders. Basic checkups include blood pressure, weight, and general examination. Important blood tests are usually done, such as complete blood count to check for anemia, blood group and Rh factor, thyroid test, blood sugar, HIV, hepatitis B, and a urine test. An early ultrasound may be done around 6 to 8 weeks to confirm the pregnancy and check the fetal heartbeat. Importance of folic acid. One of the most important things in early pregnancy is folic acid. Folic acid should ideally be started before pregnancy or as soon as pregnancy is detected. It helps in preventing serious birth defects of the brain and spinal cord. Most women are advised to take around 400 to 800 micrograms daily, but the exact dose should be guided by your doctor. Essential pregnancy care. Now let's understand what care should be taken during early pregnancy. A healthy and balanced diet is extremely important. Include plenty of fresh fruits, vegetables, whole grains, milk, eggs, pulses, and adequate protein-rich foods. Drink plenty of water and stay hydrated. Avoid junk food, raw or undercooked meat, unpasteurized milk, and unhygienic street food. Along with folic acid, iron, and calcium supplements may be prescribed by your doctor. Vitamin D or other supplements may also be recommended if required. Lifestyle care. Lifestyle habits also play a major role in protecting pregnancy. Get enough rest and sleep well. Light exercise or walking is good, unless your doctor advises otherwise. Avoid heavy lifting, strenuous physical work, or any activity that causes strain. Stress should be minimized as much as possible. Emotional support from family and partner is very important during this phase. Things to strictly avoid. There are some things that must be strictly avoided during early pregnancy. Never smoke during pregnancy. Smoking increases the risk of miscarriage, low birth weight, and health problems in the baby. Avoid alcohol completely because even small amounts can harm the developing baby. Do not take any medicines without a doctor's advice, including painkillers, herbal medicines, or over-the-counter tablets. Avoid radiation exposure, such as unnecessary X-rays, unless they're absolutely essential and recommended by a doctor.
Now, let's discuss the important risks in early pregnancy. The first and most common complication is miscarriage. Most miscarriages occur in the first trimester and are often due to chromosomal abnormalities in the baby, which are usually not in anyone's control. Other causes may include uncontrolled diabetes, thyroid disease, severe infections, smoking, alcohol, or advanced maternal age.
Ectopic pregnancy. Another serious condition is ectopic pregnancy. This happens when the pregnancy grows outside the uterus, most commonly in the fallopian tube. This is a dangerous condition and requires immediate medical treatment. Symptoms may include severe lower abdominal pain, shoulder pain, dizziness, fainting, and vaginal bleeding. If any of these symptoms occur, urgent medical attention is necessary.
Severe vomiting. Some women experience excessive vomiting, known as hyperemesis gravidarum. This can lead to dehydration, weakness, and weight loss, and needs medical treatment.
Birth defect risks. The risk of birth defects increases if the mother consumes alcohol, smokes, takes unsafe medicines, is exposed to radiation or harmful chemicals, has poor nutrition, or has uncontrolled medical diseases. That is why early care is extremely important.
Danger signs. When to seek help. Now let us look at the warning signs when you must visit a doctor immediately. These include heavy bleeding or passage of clots, severe abdominal or pelvic pain, very high fever, fainting, dizziness, persistent vomiting, fluid leakage, or if you had pregnancy symptoms earlier and suddenly everything stops along with pain or spotting. Reduced heartbeat or abnormalities seen in ultrasound also require urgent consultation.
Vaccination and infection prevention are also important. Tetanus vaccine is usually given later as per schedule. Doctors may also check rubella immunity, and flu vaccination may be recommended. Avoid contact with infectious diseases like chickenpox or rubella. Maintain good hygiene and hand-washing practices.
Mental and emotional health is equally important. Many women experience mood swings, anxiety, and emotional stress during pregnancy due to hormonal changes and life adjustments. Support from family and partner plays a big role. Talk openly about any concerns and seek medical help if anxiety or depression becomes severe.
Conclusion. So, to summarize, early pregnancy care is extremely important for a healthy mother and a healthy baby. Regular antenatal checkups, proper nutrition, safe lifestyle habits, and avoiding harmful substances can prevent many complications. Always listen to your body and never ignore warning signs. Thank you for watching this class. If you found this video helpful, please like, share, and subscribe. Stay healthy, stay aware, and take care.